Hello everyone, today we'll be talking about cognitive behavioral therapy or CBT. We'll cover several types of CBT, its key concepts, techniques, and real-life applications, so let's dive in. Albert Ellis's Rational Emotive Behavior Therapy or REBT. Let's first talk about Albert Ellis and his REBT. Alice developed REBT to help people overcome emotional disturbances by changing their irrational beliefs. He believed that it's not events themselves but how we think about them that cause emotional problems. So, here's how it works. The ABC framework, which is the core idea of REBT. The A stands for an activating event like a stressful situation. B is our belief about the event. It's the thoughts and beliefs we have. And then C is the emotional consequence, how we feel as a result. We also have D that stands for disputing, which is where we challenge our irrational beliefs and replace them with healthier, more rational thoughts. So Ellis's therapy focuses on helping people change their beliefs so they can stop feeling bad about themselves or others. The therapeutic process or the goal of the REBT is to achieve unconditional self-acceptance and unconditional other acceptance. The therapist helps clients identify and challenge their irrational beliefs, and clients are encouraged to actively participate in their therapy by doing homework and practicing new behaviors outside of sessions. So the techniques in this therapy which the therapist use includes cognitive techniques like disputing irrational beliefs, emotive techniques like using humor or role-playing to challenge negative feelings, and behavioral techniques like homework and desensitization to practice new skills. This therapy is especially useful for brief therapy and even in group counseling. So now we move on to Aaron Beck's cognitive therapy. Aaron Beck's cognitive therapy was developed to help people change their unrealistic thoughts and beliefs. He focuses on identifying cognitive distortions, which are patterns of thinking that cause problems like depression and anxiety. Some common distortions are arbitrary inference, which are making conclusions without evidence, overgeneralization, which is seeing a single negative event as a pattern. Then dichotomous thinking, which is thinking in extremes like all good or all bad. And then the therapist-client relationship in cognitive therapy is therapists work with clients using Socratic dialogue, meaning they ask open-ended questions to help clients reflect on their thoughts. The therapist is empathetic and helps clients develop new, more realistic ways of thinking. So the cognitive therapy is widely used for treating depression, anxiety, and other psychiatric disorders. It's also helpful in family therapy where it helps individuals restructure distorted beliefs caused by family dynamics. So we move on to Kristen Padesky and Kathleen Mooney's strength-based CBT. So this therapy is developed by Kristen Padesky and Kathleen Moon. Unlike traditional CBT, the strength-based cognitive behavioral therapy focuses on the client's strengths and resilience rather than just addressing problems. It's a more collaborative, client-centered approach where therapists help clients identify their personal strengths to overcome challenges. So, this therapy can be used in traditional CBT sessions as an add-on, or it can be used in a 4-step resilience model, especially for chronic issues. It helps clients build resilience by using their strengths to handle difficulties. And finally, we move on to Donald Mitchy-Baum's cognitive behavioral modification. So CBM focuses on changing self-talk, which are the thoughts and internal dialogues that influence behavior. The process happens in 3 phases. First is the self-observation, wherein the client learns to observe their thoughts and behavior. Next is the new internal dialogue, wherein the clients replace negative self-talk with positive adaptive thoughts. And finally, learning new skills. Clients develop coping strategies to manage stress and emotions. We also have the stress inoculation training, which is a key technique used in this therapy. It's a training program that helps people manage stress by teaching them specific coping skills. So, Next is the cognitive behavior therapy from a multicultural perspective. So the CBT is highly adaptable across different cultures. It's an empirical and individualized approach that can be effective for diverse populations. However, there's a need for cultural sensitivity to make sure that the CBT is properly applied in different cultural contexts. And the general application of the CBT is that it is used in many settings, including individual therapy, group therapy, family therapy. It's effective for treating common mental health issues like depression, anxiety, and substance use. This therapy can be adapted to work with various age groups from children to adults and even in group or family settings. Thank you for listening.